Talk with the audience. And brain connectomes can help us to better understand the disease, resilience, and treatment response mechanisms. And using diffusion MRI and structural connectomes, we can better understand how MS lesions and MS pathologies can impact the microstructure. And through the functional connectome, we can better understand how brain function is responding to the structural damage, because there is a compensation mechanism that might occur in the early stage of the disease. So as a response to the structural damage, brain's functional activity may increase, which may indicate the functional compensation mechanism. So it can help us to identify what are the mechanisms of functional compensation, and it can answer why some subjects do develop disability and why some subjects do not develop a disability. And it might be related to functional compensation. And if we can understand the mechanisms of functional compensation, we can use this compensation mechanism for the subjects who do develop disability. So we can use this mechanism to delay or to stop the disease progression. And with the help of artificial intelligence, we can feed structural and functional connectome to the models to make a better prediction of disabilities, because the previous studies have shown that if we use connectomes in our models, we can better predict the disease progression over 7 to 6 years. And we can also better identify who is responding to treatment and where this functional activity occurs. So it can help us in many ways to understand disease resilience and treatment response mechanisms. So clinical radiological paradox helped us to understand while the lesion number and location is really important, it's not enough for us to better understand how these subjects will develop the disability. So rather than looking at the lesion number and size, we should look at how this lesion is impacting the connections, because two subjects might have really similar lesions in terms of their size and location, but their disruption to the connectomes might be very different. So since the connectomes disruption will be very different, the consequences in terms of disability might be very different as well, and this might explain why two lesions are very similar but there are heterogeneous disease progression in subjects. So structural connectomes can help us to identify which hubs are being disrupted and which ones are more related to disease progression. And it can also help us to identify the functional compensation mechanisms. For example, let's say default mode network. There's an increased activity in default mode network which might be associated with better cognitive outcomes. So it can help us to identify this network that we can use later for simulation therapies such as transcranial magnetic stimulation. So one of the questions for this kind of therapies, where should we stimulate the brain? And the functional connectomes can help us to identify these networks that we can target to stop or delay the disease progression. And in previous work, they have shown that there's an increased functional connectivity from default mode network to the rest of the brain, as well as frontoparietal network to the rest of the brain. So it may indicate that increased functional connectivity might be a hub for functional compensation mechanism. And in our work, we also showed that the cerebellum might be an important region to predict disease and also cognitive impairment over 4 years. So maybe the lesions in the cerebellum or on the connections that goes to the cerebellum might be an important biomarker for us to identify which subject might develop more aggressive disease evolution. And if we can identify the subjects who might develop more aggressive disease evolution, we can give more aggressive treatment plans, because if we predict in 4 years or 6 years this subject might develop more aggressive disease progression, and then we can identify the subjects and then provide more powerful treatment plans to delay or stop disease progression.